Good evening, dear viewers, and welcome to today's episode of Visite on this wonderful weekend and Sunday evening. Thank you for your time, and thank you for all the valuable correspondence that I was able to receive, and I have chosen 2 letters. The first is from a family that have asked for my advice. The 5-year-old little daughter has now a confirmed house dust mite allergy, and the recommendation from a family doctor's point of view was a thorough and recurring cleaning and washing of all stuffed animals, and also special bed linen, special covers for the couch furniture. But maybe there is something else you can do. The little one is a bit latently overweight and grows up in a parental home where there is also certain tension to be endured, and she has an older brother. I have to tell you, any allergy, also in children, is not something that should somehow cause us to see it as an event that cannot be changed. Children are born into their microenvironment. They are born, and now their stability and their physical defence will firstly be shaped in the upbringing and in the care and also in the resilience by what children experience. And it is very important, if you have an overreaction on the immunological level to house dust mites, that you understand that the house dust mite is not the reason, but always only the trigger. An overreaction of the immune system actually means that the body is getting ready for something, what it does not recognise as foreign. So it recognises it, but it reacts absolutely wrongly. It overreacts. In other words, how many processes must actually have taken place in the background for this immunological disorder to occur? And it is very important that you understand that we first have to look how it looks inside the little one. If you say a little overweight, then I can imagine that the share of carbohydrates is also quite high. Of course, children of this age long for sweets. And I've made house calls for 20 years. I've always been amazed that it's normal that giant candy bars are at home, that children actually always have something to chew, whether they're gummy bears or other sweets. According to the motto, if it is there, they take less. That's not true. Sugar has one of the highest negative effects on our children, worse than you think, and that's where the dose makes the poison. Sugar is a big robber of B vitamins, and above all, the sugar stimulates fungal growth. So many fungal cultures that simply displace the healthy microflora in the intestine, and the whole microbiome of these kids is actually slowly manoeuvring itself into quite a catastrophe. Now, add to the fact that you may have a microwave at home, and on top you might sometimes practice quick cooking at home so that the children eat a lot of wheat products. Then it becomes really difficult for the intestines. And that is why this is very important in an allergic situation, whether this is a house dust mite allergy or whether it is the early bloomers or whether it's a child's asthma which you cannot explain. The intestine, and it needs a stool exam, a status of the stool, which tells me what is the pH of this child. What is the microflora like? Does it have enough lactic acid bacteria? Is there any inflammation that we don't know about? Remember, the colon is related to the lungs. This little one also has asthmatic conditions again and again, and now sprays a cortisone spray. That's not it. It is this gut immune system that has long been in a form of overreaction. The health of my intestinal mucosa is the health in my lungs. So everything that may result in increased permeability of the intestinal mucosa due to irritation can trigger asthma in children because of this lymphatic connection via the Peyer's plaques of the intestine with the pulmonary epithelium. In addition, there is a strong microbial lobe, the inflammation on a physical level, the change in the whole microbiome for the lungs. That means everything stands and falls with the decision and responsibility of how the child lives and what it eats. So I'm asking you, please try to slow down again. As a parent, try to feed this child with a higher responsibility. Quietly try to reduce the overconsumption of sugar. You are buying it. Try high-quality vegetables, salads, fruits. Sugar becomes an addiction. Try to change these things quietly, not by prohibition, of course, but by being psychologically wise. And if this mucosal immunity, if this secretory IgA that you can measure, when these food intolerances, which repeatedly cause inflammation, and also the adaptation against a house dust mite naturally wears off, in this form of allergy, become intolerable for the child, then there is a lot to do, which first of all needs a certain balance in the organism. Very strong and good anti-allergic things are zinc. For children, this is, for example, Zincokel from Sanum, 10 drops 3 times a day, and above all, vitamin C. Vitamin C in liposomal form, and also as lemon juice or other vitamin C products. And then, of course, it is very important to consult a therapist with a stool diagnosis who will advise you, or depending on the clinical findings, then will work with effective microorganisms or with a SymBioFlora program, or there are enough experienced naturopaths or also naturopathic doctors who are very knowledgeable about these things. But the child doesn't have to feel isolated. And above all, it must grow up in a beautiful and loving environment. Please do not underestimate the lungs are the organ of communication, which perhaps also causes a certain amount of tension on the child due to the tension from the outside. It's always about everything, and it's about an increased adaptation back to life. And there are a number of other effects that can ultimately trigger a dust mite allergy. I myself have worked with the so-called Imhauser's autologous blood therapy on children. That would also be an option that you could maybe discuss with someone, because you train the immune system with it, even if it is not confronted with the house dust mite or other allergies at the moment. But on the other hand, there is also the 2L Allerg from microimmunotherapy, a really wonderful therapy for immunomodulating these children. I hope to have helped you, dear parents of the little one, and not just to believe that it's done only by removing the house dust mite. from the environment again and again. It is part of our life too. It is also there when she goes to a friend's house. It's also there when you go on holiday. She herself has to get stronger, and she has to be relieved of that which has also weakened her. I still forgot, next to a carbohydrate or gluten-reduced or free diet, please be sure to leave out milk and dairy products. This is about lymphatic regulation, and the children are in an absolutely different immune situation tomorrow if you really leave these things out. By the way, I used to have a lot of admiration for Dr. Wertmann. He was an Austrian paediatrician, and what I liked very much was that Wertmann was also very radical. So if a child had atopy, neurodermatitis, if a child had asthma, he always invited the parents and grandparents for a consultation. And I just did the same all my life, because it makes no sense to want the best for a child and the grandmother or grandparents are then showering them again with things that the child should simply learn, that they actually make them sick instead of leaving them healthy. And what I found very admirable, when parents smoked, for example, and the child had asthma, I did not treat the child, but instead made the parents responsible for stopping smoking now, so that I can really help the child. And it is your responsibility whether the child is allowed to get well tomorrow or not. And with that in mind now, I would like to ask you, our children are always the result of a life that they are allowed to lead. Children are born into families. We cannot choose this place. We love our children more than anything. But as parents, we sometimes don't do everything right. Not all of it, but many things we don't do that well sometimes. But we can also learn, and we can listen to people just like today. And I can tell you from experience that it really is not an unsolvable problem to get a house dust mite allergy back under control for the children in the long term, because be aware of one thing. It is a house dust mite allergy today, and tomorrow it might be against strawberries and early bloomers. And the day after tomorrow it is against completely different things. The problem is the small immune system, which has become malfunctioning. And so the main points of attack are the mucous membranes. And now I think that's a recommendation that you can implement in one or the other detail quite well. Good. We still have time for a second email. And that comes from Monica. This is an email in which she writes that she had her first birth 18 years ago and had no issues or problems until then, nor any other complaints. Never any stomach or stomach acid complaints beforehand, but she was still of normal weight at the time and is now overweight. That's one thing. But 17 years ago now, it was about 17 years ago, after the first birth, I could hardly move. And I could hardly get my little son out of bed. At that time, I had been given pain pills and physiotherapy, and the advice to lose weight. So she then had a nursing job, and then the back pain kept coming back. She became a mother a second time and then a third time. And it was exactly 6 years ago that she was given an injection in the lower back, and then it went better. And then she could go to physiotherapy and muscle building and somehow get on with life. But then the third time was exactly 2 years ago. It was March. She could even describe it still with the time. She writes, "When I made the bed, a disc literally burst. It was an unbelievable pain in the right leg, and it was unbearable. The family doctor then immediately sent her to do a scan, and after 4 weeks, really being unable to take it any longer, the date for the operation was repeatedly postponed. But she couldn't really bear this severe pain anymore. It drove her insane. And then she was operated on. This surgery was supposed to be the big fix. But she wasn't completely healthy, and she can put weight on her leg again, but she is in pain every day to this day, and is repeatedly every 1 to 3 days. She says, punished with strong pain. But you shouldn't see it that way. The upper back has started. It goes up to a headache, and my right leg keeps cramping. Well, the doctors say you can't cure that now. I have to live with it now, and at some point they want to stiffen my back, and that's how long I should take the pain medication. Wow, this is a big, really big problem. And I want to try to give a bit of advice on this issue. I had a practice in the Uckermark, 70 kilometres north of Berlin, for 20 years. And I always had many male patients there because there was a large sawmill near me. And the guys who worked there have had immensely heavy physical exertion, of course, by directing the tree trunks and putting them in the machines and sawing them and so on. And I've had quite a few people who have had severe herniated discs and really crawled on the floor in pain. But after a certain time, they went back to their old job. That means it has been on the brink sometimes. Will it be possible? But only the fact of a herniated disc, and only the fact that an operation took place, is far from an explanation that you still suffer from this back pain today. That is the first thing. The second is that I once helped a young man to get a really small pension because the young man was illiterate and nobody cared about him anymore. And just out of responsibility for him, I made a CT scan of the back, and he had a large herniated disc, but he had no symptoms. And that was enough at the time to get him into the social network for the first time until he really stood on his own 2 feet later on. But I just wanted to be able to tell you these 2 examples first, that the fact alone of the operation and the herniated disc do not necessarily explain why you are still in pain today. You said you have 3 children, and of course my question is if they were normal births or whether they were perhaps also caesarean sections. If they were caesareans, then you always have to know that the caesarean section scars alone are quite an interference field, and there's a large part of patients I remember who kept coming back with their pain again and again, and by improving regulation with the scar treatment, the pain was clearly reduced. When a scar or a dead tooth cause a meridian blockage, this is called an interference field, so the energy does not flow on this meridian. And 5,000 years of Chinese medicine has the knowledge that the energy must be produced, but the energy must also flow. And I myself have an incredible amount of experience with these things. That's why my wish is always to give power back of regulation to humans. And the question is, of course, what is your regulatory power? Of course, it all starts somewhere. Of course, a mother also has a lot of stress. Of course, giving birth is exhausting. But are there perhaps also dead teeth? Are there any scars, abdominal scars? Then it has to be integrated into this treatment, and quite urgently. The body is just always the result of your own life. And a muscle that shortens on one side will lengthen on the other side. Every muscle has an opposing muscle, which means, and you will notice that too, the whole tension problem already goes over the thoracic spine, over the cervical spine and the head, so headache. This means that tension is, of course, also transmitted via muscle chains. And to recognise this tension, pressure, pain, loss of movement, worry and fear, will I be well again? There is only the option of stiffening. You have to try to get rid of this and face the process. And for such things, neural therapists are very valuable. Because as neural therapists, we take care of improving regulation. We look at the teeth. We look at scars. We look at faulty statics. We look for overload, improper load. That's one thing. And through neural therapy, sometimes by syringes, by injecting procaine or lidocaine into certain nerve plexuses, we can bring back some relaxation. The therapies that are linked to it are either Liebespracht or myoflex therapy. These are wonderfully trained therapists who are not doing physiotherapy with you at the moment, but do a treatment via trigger points. That really stimulates an impulse to the brain, which reflexively results in muscle relaxation. And if you go to myoreflextherapy.de or look at liebespracht.com, where are therapies in your area, then I would ask you to clarify, how is my regulatory power? It could also be that you have also had a thyroid operation, or you also have an appendix scar down here, or don't underestimate the biggest scar in humans, the navel. So maybe it's also about the scar on the back. There is also a scar from the operation. These are incredibly valuable things that suddenly give the whole thing a completely different impulse. And get rid of those fears, get rid of these worries. Make sure that your muscles are in good relaxation, which is not only built up mentally, but also through really muscular relaxation through magnesium. Check that you don't have a calcium excess somehow. That also creates dramatic muscle tension. You can measure all of this. Make sure you have right spinning lactic acid. For example, through Regulat, also applied. Muscle tension creates hypoxia. Hypoxia means that the muscle does not get enough oxygen and produces left-spinning lactic acid, and thus it has an inflammatory process again. And because there are nerves from the spine, these are pivots again and again, which of course can also radiate from the lumbar spine area into the lower area up to the big toe. Myoreflex therapy or Liebespracht is not quite a relaxing therapy. It will be a little bit challenging, but you will get ahead. And most importantly, you need to know what you can do to slowly get moving again. And always remember that our intervertebral discs, including our fasciae, a lot has to do with the fasciae, with blood circulation, with warmth, but also really with movement. And if you are a little traumatised, then somehow you already have a certain fear of the moment because you've heard it crack once, you still know it well, down to the hour, You have never forgotten the day you have the cracking in your ears, and maybe there is still a certain inner fear and tension behind it. And I have to tell you, in all honesty, that these are also great mental demands on yourself. But I would wish from the bottom of my heart that slowly you are starting to move again in your life, but above all, you are also getting your strength. You come to safety, get to relax, come to serenity, and at some point can say, I had something, but it somehow helped me to understand something for myself, which I simply have to practice and live, and it's up to me to change it. And don't have to wait for the time to get my back stiffened. A doctor often gives advice, not for the highest reason of science, but from experience, from seeing, from looking. And I have to tell you, this young man back then, with his large herniated disc, that really impressed me. But he, of course, really didn't understand the dimension of this at all. But he didn't care either, because he really didn't have any symptoms. That's how it is in our body too. It can actually compensate for things pretty well. But the tension on my back is controlled by my brain, by the information. And whether I build up the tension or relax the tension, it all happens unconsciously, and it is not controlled by what I want now and what I do, but a little bit by what I feel. And with that in mind, I wish I could take some of the burden and worry off your shoulders. And I don't want you to think that this is an easy way, but I can assure you that it is a worthwhile way. If you maybe approach things again with the help of really great colleagues and neural therapists, and also myoreflex therapists, and above all, please ask a holistic dentist to have a look, that there are not any impacted wisdom teeth in there, because these are also huge interference fields, especially for the sacroiliac area, the lower lumbar spine. And with that, sometimes there is already a liberation, because these interference fields can only become interference fields because maybe something in your body has weakened, and this situation is only now kicking in. So in this sense, I would very much hope that there is a time for you again when you can live pain-free and a little more carefree with your 3 children and the wonderful family. With this in mind, I wish you all a wonderful Sunday evening and a wonderful week for all of us, and enjoy this summer. And whenever you want to ask me your questions, please send them to visit@qs24.tv. With this in mind, I am very much looking forward to the coming Sunday. Stay safe and goodbye.